Hi, and welcome back to the Wellbe podcast, a weekly series designed to help you learn, expand what you thought was possible, and become as empowered as you can possibly be in your health. I'm your host, Nolan-Smith, a board-certified holistic patient advocate and the founder of Wellbe. And today I'm bringing you a brand new episode all about miscarriages. This episode is part investigative guide and part personal. I'm going to be sharing my experience with miscarriage as well as the research behind how common they are, the 6 main causes of why recurrent miscarriages happen and what you can do about them, what to do if you can't figure out the root cause of recurrent miscarriages, and the odds of having a healthy pregnancy after miscarriage, and much, much more. Before we jump in, I want to give a shout out to MCD Musician, or as she or he is known, who left a review of the podcast that said, "This podcast is packed full of info that helps you take over your health and become aware of all the ways we can make good choices for our bodies. I love how the information is understandable, relevant, and positive. As someone who has been on a journey with holistic healing methods for most of my life, I still always learn something new from it. Highly recommend this podcast and the Wellbe resources." Thank you so much, MCD Musician. I'm so incredibly touched by your kind words. They mean more to me than you know. If you're listening, please email hello@getwellbe.com, and my team is going to send you a special gift in gratitude for leaving a review of the podcast and for such sweet words. If you want a shout out from me or a chance to win a gift from Wellbe, make sure you leave a review wherever you listen to podcasts. You don't even have to stop listening to this episode. You can do it right now. Just scroll down on our podcast page in your app and click Write a Review. Give us a few stars and a few words, and then press Submit in the top right-hand corner. It's super fast and easy, but actually very, very important for any podcast, so thank you for doing that now. All right, now while I feel incredibly lucky and grateful to be more than 34 weeks, or nearly 8 months, pregnant today with my first child, I want to share that I did have a miscarriage a few months before conceiving. I'm sharing this because I think it's important for those women and families in the Wellbe community that may suffer from infertility or who have had miscarriages to know that not every woman's journey is simple and easy. I was fortunate in that I was able to get pregnant just a month after beginning to try for a baby, but only knew I was pregnant for about a week before I had a miscarriage just before the 6-week mark. It made me dig into the research behind miscarriages. How common are they? What really causes them? How much do they affect future fertility? As you can imagine, I had a lot of questions, and I never thought I'd be someone that had a miscarriage. Though I was able to conceive again after 3 or 4 months after my miscarriage and am now just a few weeks away from delivery, I wanted to share with you what I learned in my research. While having a miscarriage can be uniquely devastating in each individual incidence, it's actually shockingly common. While the numbers vary depending on who you ask, it's estimated that between 10 and 26% of all pregnancies will end in miscarriage. And there may be even more that happen very soon after conception, before a woman even knows she's pregnant. About 75% of miscarriages occur in the first trimester, or the first 12 or 13 weeks, and are known as early miscarriages. Most women who have had one miscarriage will go on to have healthy pregnancy or pregnancies, like I did. Recurrent pregnancy loss was traditionally defined as 3 or more consecutive miscarriages, but the American Society of Reproductive Medicine recently reduced that number to 2. A loss can refer to any pregnancy that was confirmed via pregnancy test or ultrasound, or in which pregnancy tissue was identified after the loss. In other words, this number doesn't account for very early miscarriages, known as chemical pregnancies, which often happen without a woman ever knowing she was pregnant. Having multiple miscarriages is less common, but by no means rare. As with single miscarriages, the numbers vary a bit depending on who you ask, but it seems that between 1 and 5% of women experience 2 or more consecutive miscarriages, while 0.5% to 2% experience 3 or more. While having just one miscarriage doesn't affect your odds of having another, a cruel little biological reality is that with each subsequent miscarriage, your odds do increase. After 2 miscarriages, your risk of another one is 28%, and after 3, it jumps to 43%. There are a number of potential causes of recurrent miscarriages, most of which fall into 6 general categories: genetic issues, uterine issues, autoimmune issues, hormonal issues, stealth infections, and poor gut and vaginal microbiome health, and then environmental and lifestyle factors. So first, let's talk about genetic issues. Random chromosomal abnormalities are the most common cause of recurrent miscarriage, accounting for 50 to 80% of all first trimester losses. This can happen when the mother or father have a slight irregularity in their genes, which doesn't affect them but severely affects the embryo, resulting in an abnormal number of chromosomes or chromosomes in the wrong place, known as translocation. Usually these parental chromosomal abnormalities are only passed on randomly once, but sometimes they can be passed on repeatedly, resulting in recurrent pregnancy loss. Chromosomal abnormalities can also happen completely randomly at the time of conception, without anything being passed on from either parent. The risk of this sort of random genetic issue increases with the mother's age, likely because egg quality tends to worsen as a woman gets older, and poor egg quality is associated with genetic abnormalities. This is thought to explain why a woman's risk of miscarriage increases with age, from 12 to 15% in their 20s, to 20% at age 35, to 40% at age 40, and by the time a woman reaches 45, it has doubled to 80%. Next up, we have uterine problems. So about 18% of women who experience recurrent pregnancy loss have some sort of structural problem or abnormality with their uterus, usually something they're born with. About 3% of women are born with abnormalities in the size, shape, or structure of their uterus. This could mean a double uterus, a septate uterus, meaning there's a wall of tissue dividing the uterine cavity in two, or benign uterine growths like polyps or fibroids. Some women with recurrent pregnancy loss may have Asherman syndrome, in which adhesions and scarring form in the uterus, resulting in repeated miscarriages. Note that a number of these uterus-related issues can indicate underlying hormonal issues, as both uterine polyps and uterine fibroids can be caused by high levels of estrogen, and Asherman syndrome can be caused by endometriosis, which is an endocrine issue which has many, many root causes behind it, also dealing with hormones and the gut and lots of other things. So we'll get into those in a minute. Next up, we have hormonal issues. It shouldn't come as a shock that proper hormone levels are required for a successful pregnancy. This means that women with hormonal imbalances or hormone-related disorders like thyroid disease, uncontrolled diabetes, and PCOS are at a higher risk for recurrent pregnancy loss. Hormonal issues related to the thyroid and pituitary glands can be particularly troublesome since they lead to high levels of prolactin, which interferes with the production of other reproductive hormones. Next up, we have autoimmune issues. Now, there's an autoimmune disorder called, bear with me, antiphospholipid syndrome, known as APS, in which a woman's immune system mistakenly makes antibodies to certain substances involved in blood clotting. For a pregnant mother with APS, her body produces these antibodies which indirectly cause clotting in the blood vessels involved in developing the fetus, depriving the fetus of nutrients and leading to miscarriage. Lupus can also increase your risk of miscarriage, as can many other autoimmune disorders such as Hashimoto's and others. Next, we have stealth infections and poor gut and vaginal microbiome health. If a woman's internal microbiome is off, it can make it difficult for her to sustain a healthy pregnancy. Bacterial infections like malaria, the flu, and bacterial vaginosis can all be fatal to a fragile fetus. What's more, these infections are often upstream from a hormonal or autoimmune issue, which then is the triggering cause for a miscarriage. The makeup of the vaginal microbiome can also cause miscarriage, with imbalanced levels of good and bad bacteria increasing the likelihood of first and second trimester miscarriages. Poor gut health in general can also lead to recurrent pregnancy loss. I've said this before and I'll say it again, gut health affects everything. So if you haven't seen it already, head right to getwellbe.com and grab our free gut health guide. It is the best place to start to sort of evaluate and plan out how you can improve your gut health. Now, It makes sense that our gut health affects how our body absorbs vital nutrients and that these nutrients are necessary for a developing baby. Leaky gut has been associated with recurrent pregnancy loss, as has irritable bowel syndrome. All right, next up we have environmental and lifestyle factors. While the factors I just described all have to do with what's going on inside a pregnant woman's body, there are multiple recurrent miscarriage causes that happen on the outside. Exposure to certain chemicals, drugs, radiation, and other environmental toxins can raise the risk of miscarriage. For example, heavy metals, petrochemicals, PFAs, and many more. What you put in your body also plays a role, with smoking, drug use, caffeine, and alcohol all increasing your miscarriage risk. Even a small amount of alcohol, one study showed, increases your miscarriage risk, as well as being significantly overweight or significantly underweight. Certain foods like raw fish and cured meats that might contain listeria, as well as certain seemingly random specific things like hibiscus tea, can also increase miscarriage rate. I happen to have had a cup of hibiscus tea in the week that I knew I was pregnant without understanding that there was a miscarriage connection until after I had miscarried. And I felt like there should be warnings on that sort of a tea box because I, of course, had no idea and I would have never had it had I known. A small 2017 study also showed a connection between women receiving repeated flu vaccinations and an increased miscarriage risk. I hope you're finding this episode to be informative and interesting. Let's take a quick break to hear a word from our sponsor. You know, when I dug into the research behind miscarriages, I had no idea that environmental exposures were a root cause, and inversely, that detoxifying your home and personal care products, drinking clean water, and all the other essentials that I've been talking about for years at getwellbe can help with infertility and reducing your miscarriage risk. I'm so adamant about this being the first step to creating a holistic lifestyle and healing any sort of chronic health issue or symptom, infertility and recurrent miscarriage included, that I've created an entire program called the Spark Health Program that takes you through the steps of detoxifying your home and personal care products in 6 weeks and includes a year of free access to the getwellbe non-toxic product database, a database I've spent years creating with over 1,500 vetted, curated, and rated non-toxic products in categories like home cleaning, kitchenware, makeup, skincare, water filters, clean food brands, practitioner-grade supplements, and much, much more. When you go through the program, you'll not only have help understanding what in your home and life is harming your hormones, but then we make it super easy to get rid of and replace those things so that you can say, voila, done by the end of the 6 weeks. If you just want access to the product links, no problem. You can purchase access to the getwellbe non-toxic product database alone, though fans tell us going through the clean out process with the Spark Health program means it will actually get done, not just added to your endless to-do list. If this is something you've been meaning to do or know that you really should, head to getwellbe.com today and enroll in the Spark Health program, which includes access, as I mentioned, to the non-toxic product database, and start taking inspired action to reduce your miscarriage risk today. Though the various causes of recurrent miscarriage often remain unknown, new testing capabilities and greater understanding of the pregnancy process makes it possible for about 60% of women to get to the root cause. If a woman has had 2 or more miscarriages, they should work with their doctor or practitioner to try to identify the underlying issue. Doing this involves various different diagnostic tools, such as genetic testing. This testing can be done on the embryo after miscarriage to determine if chromosomal issues were the cause. Partners experiencing recurrent pregnancy loss could also have their own DNA tested to look for inheritable genetic problems. Testing of the parents usually looks specifically for translocation, again, when part of the chromosome breaks off and attaches to a different chromosome. Then there's anatomical testing. So this testing will look at the structure of the uterus and other reproductive organs to see if there are physical problems. Anatomical testing includes ultrasounds, sonograms, MRIs, and X-rays, among others. Though I do warn you to be careful with this because radiation from medical imaging testing is the leading cause of radiation for all humans, and it can lead to miscarriage. So make sure that you navigate this process correctly and don't get a ton of testing. Next, we have autoimmune testing. Doctors can run labs to look for antibodies that might indicate an autoimmune issue, specifically APS, but also things like a full thyroid panel that might show whether you have Hashimoto's, or other labs to show whether or not you might have lupus or rheumatoid arthritis or other autoimmune conditions. This is usually only done if there have been 3 or more miscarriages. Next, we have hormonal testing. These tests look for imbalanced levels of certain hormones like prolactin, as well as hormone levels that indicate ovarian reserve. They'll also test for thyroid antibodies. A good doctor or practitioner will run a full thyroid panel, not just test your TSH or just your thyroid antibodies, which is standard. So make sure you get a full thyroid panel. And they'll also test usually for insulin resistance. Next, we have medical history. It's important to take into account both partners' medical history as well as their family medical history. Either side might hold clues to the causes of recurrent miscarriages, even if those clues are from previous generations. As with any health issue, treatment will vary depending on the underlying cause. If fibroids and polyps are found, they can be removed, though you'll still need to figure out the root cause of why they developed in the first place to avoid future miscarriages and reproductive health issues. If genetic testing shows inheritable issues in either parent, a couple could choose to do IVF and screen the embryos for genetic problems. If there are hormonal issues, women can take steps to bring their hormones back into balance and so on. We have some great episodes with Dr. Aviva Ram and some other investigative guides, which you can check out by scrolling through your podcast app on the Wellbe podcast page, or you can just head to getwellbe.com and search there for hormones, and you'll see a few different both articles and podcasts there. For many women, the cause of recurrent miscarriages remains unknown, but this doesn't mean that all hope is lost. In fact, after experiencing recurrent pregnancy loss, a woman's chance of having a healthy pregnancy in the future is still 70 to 80%, even without identifying a root cause. There are a number of specific research-backed steps that women and their partners can take to reduce the risk of miscarriage, regardless of what may be contributing to their recurrent pregnancy loss. Number 1, maintain a healthy weight, both while trying to conceive and after getting pregnant. The ACOG offers specific guidelines on healthy pregnancy weight gain that you can check out. Next, avoid alcohol, caffeine, drugs, and smoking during pregnancy. While a small amount of caffeine, up to 200 milligrams per day, has been shown to pose little risk or be relatively safe, this is across-the-board advice. Each person is unique, so a small cup of coffee could have a more severe impact on certain women and therefore certain pregnancies. And remember that not all coffee has the same amount of caffeine in it, so make sure you understand how much caffeine you're drinking exactly. This is a call that each pregnant woman has to make on her own, but being informed about what you're actually consuming is the first step. Next, eat a well-balanced, whole foods-based diet, which I've said so many times on the Wellbe podcast, and take a prenatal vitamin, as well as other vitamins and supplements if you have identified some micronutrient deficiencies, to ensure that you're getting all the nutrients you need to grow a human. Next, reduce your exposure to toxins. Do an audit of your home, work, or anywhere else where you spend a lot of time and identify any harmful exposures. Then take steps to eliminate them, such as buy a water filter or an air purifier, swap out chemical-filled products for clean ones, toss your plastic items, especially your plastic food items, and so on. The Wellbe Spark Health program, as I mentioned, is a step-by-step, clean it up, clean it out program to help you do just this. Next, get regular prenatal care. Multiple studies show that simply being regularly monitored and receiving psychological and emotional support from care providers, partners, and family members can improve the odds of a successful pregnancy. Having a miscarriage can be one of the most difficult things a woman ever experiences, and having multiple miscarriages can be absolutely heartbreaking. However, it's a problem that can be addressed and can result in a happy ending. Here's what to remember about recurrent pregnancy loss. 1, miscarriage is very common. Anywhere from 15 to 25% of known pregnancies result in a miscarriage. Reoccurrent pregnancy loss, defined as 2 or more consecutive miscarriages, is less common. Between 1 and 5% of women will experience 2 miscarriages, and between 0.5 and 2% will experience 3 or more. Next, there are 6 primary causes of recurrent miscarriage. 1, genetic issues, such as chromosomal abnormalities that can be either random or inherited. 2, problems with the uterus, so structural issues like a double uterus or abnormally shaped uterus, or growths like polyps or fibroids. 3, hormonal imbalances, so conditions like diabetes, thyroid, or pituitary problems, and PCOS can all result in hormonal problems, or a woman could have hormonal imbalances without a hormone-related condition. Next up, we have autoimmune issues, specifically autoimmune disorders that result in blood clotting, like APS and lupus, which I talked about, but also others like rheumatoid arthritis, Hashimoto's, and many others. Next, we have stealth infections and gut and vaginal microbiome health. And then lastly, we have environmental and lifestyle issues such as diet, exercise, weight, alcohol and caffeine use, exposures to toxins, etc. Next, remember that testing is generally needed to identify recurrent miscarriage causes. This can include genetic testing, autoimmune testing, hormonal testing, microbiome or stool testing, and anatomical testing. Doctors should also take a full medical history of both partners and make sure they test for sneaky things like high levels of heavy metals or mold exposure or other self-infections. Lastly, treatment of recurrent pregnancy loss depends on the underlying cause. When a root cause can be identified, that issue can be directly addressed. When a specific cause can't be found, women still have a high likelihood of a healthy pregnancy in the future simply by receiving regular monitoring and making healthy lifestyle changes. All right, so that's all I have for you today on this sad but also hopeful topic. If you've experienced miscarriage or multiple miscarriages, I want you to know that you are not alone at all, as I hope you have realized from some of the statistics that I mentioned. But I know it can be a very lonely experience, and you can't help but think something's wrong with you, you're broken, you're not able to do this, seemingly natural and normal process that women have been going through since the beginning of time. But that's not true. Just like anything else, when you can understand the why behind it, how you can fix it becomes so much more clear, and it's much easier to put one foot in front of another to heal some of the underlying reasons that you might have had a miscarriage or have multiple miscarriages. If you are interested in sharing your experience or your story, please do. Absolutely no pressure, but if you'd like to, head to the article version on getwellbe.com of this episode, and you can do so in the comments there. I put a link to that article in the show notes in case that is something you would like to do. Also, while you are there, become a WellBe Insider so that you can get all of our latest content, special offers, and personal notes I don't share anywhere else weekly in your inbox. Plus, you'll get a free copy of my audio guide on how to feel the best you've ever felt and heal anything. The 10 things you need to optimize your health and heal any health issue, big or small, naturally. Even if you're the healthiest person out there, I promise you'll learn something you didn't know before that can help to optimize your health. I'll see you back here next week for another episode of the WellBe Podcast. If you haven't already and found this episode helpful or interesting, subscribe to the podcast. This way you'll never miss a new episode, and they'll be delivered to you whenever we publish a new one. And please share this episode with family or friends who you think might find it valuable and informative. It means a lot and helps more people find the podcast. If you already have, then thank you so much. I really appreciate it. Once again, this is your host, Adrienne Nolan-Smith, and thanks for listening to the WellBe Podcast.